Hey guys, this is Dr. Hub. Today we'll look at the torticollis. So what is torticollis? It is a cervical deformity. So it is a cervical deformity and in which the head is rotated and tilted towards one side. So the head is rotated. So it is not just being rotated, it is tilted to the other side and it is tilted to other side. And there is a presence of lateral rotation. So there is lateral rotation as well. Now let's move on to the causes of torticollis. What are the causes? The causes is there is a congenital torticollis. So under congenital torticollis, it is nothing but it is also known as the infant torticollis. And what are the some features? Features is it is most common and it is caused. What is it caused due to? It is caused due to the malposition in utero. It is due to the malposition and this is in utero. Next is there is presence of the birth injuries. There is presence of birth injuries and birth injury in difficult labor or the breech labor. In terms of the difficult labor or in terms of the breech delivery. Other thing to note is that it is due to the SCM muscle. It is due to the SCM. SCM stands for the sternocleidomastoid. So SCM muscle fibrosis. Now let's move on to the secondary torticollis. In terms of secondary torticollis, it is acquired condition. It is an acquired condition and it can result due to infections. So it is due to the infections. It can be due to the tumors and it can be due to the inflammatory disorders. Inflammatory disorders or as well as the trauma. Now moving on to the CF, there is clinical features. There is head tilt towards the affected side. As we discussed, there is head tilt. This is to the affected side. And the face is rotated towards the contralateral shoulder. Face is rotated and rotation is to the contralateral shoulder. So what is this position known as? Commonly this position is nothing but the cock-robin position. It is the cock-robin position. Next is we move on to the palpable nodule. That is a palpable nodule. A palpable nodule is seen in the affected sternocleidomastoid. Is seen in the affected sternocleidomastoid muscle. And this is seen in the first few weeks after birth. In first few weeks. After birth. And it disappears within few months. So it disappears. So disappearance is within the few months. Next is there is a asymmetry of the face. There is asymmetry. And this is nothing but of the face. So what is this known as? This is known as the hemihypoplasia. So it is nothing but the hemihypoplasia. And there is flattening of the one side of the skull. there is skull flattening on one side. Skull is flat on one side. So this is known as the plagiocephaly. So this may be present. Next is looking at the management. What are the findings? So in management, there can be the conservative treatment. Let's not write CT. Conservative treatment. And this means the stretching of this SCM muscle. So what we do is we stretch. We are involved with the stretching of the SCM. SCM stands for the sternocleidomastoid muscles. So there is stretching of the SCM muscles, and we manipulate the infant head manually. So manipulate the infant head manually. Next is the operative management. So in terms of operative management, there is a release of the SCM muscle. So you release the sternocleidomastoid muscle, and it is delayed until school age. It is delayed until school age. To learn and grow daily like this, please do subscribe.